Hello everybody and welcome to GradCast. GradCast is the official radio show of the Society of Graduate Students here at Western University, broadcasting from 94.9 CHRW. And I'm Alex Mozinski, your host today, joined by...
And I'm Tyson Davis, back from a long Christmas break. We're here today with Steffie. She's a pathologist's assistant, right? You're in the program for pathology assistant, right?
Yeah, that's correct.
Can you tell us a little bit about that program?
Well, do you guys know what a pathologist assistant is?
I have a very rough idea, given that I had a friend in the first class of that program, actually. So she graduated like a year or two ago now, or longer, I don't know, a while ago.
You're old, Alex.
I'm a little getting there. So yeah, like you guys basically, from the sounds of it, get to do pretty much everything like that a pathologist does. Like it sounded amazing. You guys get to like do full autopsies pretty much, and it's
with a lot less school.
Yeah.
So basically, we're just highly trained healthcare professionals that work under or being supervised by a licensed pathologist assistant. And with that being said, we're allowed to take care of basically all the tissues that are removed from surgery, grossing all those specimens, and to some extent, depending on where we're situated, we can take care of post-mortem examinations.
Wow. So I guess my first question, which I don't know, maybe kind of silly, but are you going to make actual like pathologists obsolete?
Oh, there's no way. Not at all. There's a lot more to pathology than just cutting up specimens. Once we do that work, the next step it goes to histotechs, which prep them for slides, and then we need somebody to look at those slides and make those diagnoses. So that's where the pathologist comes in. We're not trained to that expertise, though we do have some background in histology.
Wow. Okay. So how did you find out about this program, and kind of what drew your interest really in becoming a pathologist assistant?
It's funny you asked that, because if you were to ask me that question a year ago, I would not know what a pathologist assistant was, and it actually fell in my lap. This is actually my second graduate degree. I did a first one at the University of Windsor, and I was actually a fish biologist. But I did a teaching assistantship in human anatomy, and part of the course was going over to the adjunct Schulich School of Medicine, and we actually got to open up cadavers and manipulate the structures, and I actually fell in love with that. And I was like, you know what? Fishes are boring, so let's, go into a more clinical setting. And I did some research, and I came across this, and it seemed to really appeal to me.
Sounds amazing. I did not know about this program actually until I got here, and like I said, a friend of mine was in that program, and now I'm still a grad student, still living fairly beneath the poverty line, and she is I've never actually got a definitive answer from her, but she sounds like she is making, the only thing I can really say to describe it is a lot of cheddar. She's raking them in, and it's amazing. Mm-hmm. So like, kudos to you for choosing something that actually is.
It's not all about the money.
But a lot of it can be.
It's nice though.
It's nice to have that on the top. So that's impressive. So what kind of, I guess, fish biology, and I guess your undergrad, what did you do for that? And what kind of, I guess, background did they recommend you have to go into this kind of program?
So my undergraduate degree was in biological sciences, and to anyone who looks at the program here at Western, you'll see that they do have some prerequisites, and taking a science-based undergrad definitely does help you reach those requirements a lot more, quicker than if you were to do like a BA. They would like some biology, definitely some physiology, understanding of that. Some organic chemistry is optional, I believe. And yeah, basically all your physical sciences and microbiology and all that jazz.
So for me, with just a BSc, a generic BSc, I would qualify for the requirements for that program? Because it sounds like there's more money in that than there is in my research. I have to be honest here.
I don't know what each program requirement is, but definitely cross-reference it with the requirements they have on hand and see if you meet the cutoff.
So I guess getting back to the idea of research, typically, most of the guests on the show do some kind of research because they're kind of, let's call them generic grad students, like us, and you know, in the pathologist assistant program, it is a professional program. Are there kind of practicums that you have to do, and within that, is there any research-based thesis type of component to the program that you have to do?
Yeah, so in terms of research, we're actually just getting started with that. All the first-year PAs, we actually today just got our research project list. And basically, it's not as intensive as if you were a thesis-based student, but a lot of the projects go around quality control or creating teaching modules or grossing manuals as well. It's only a 1-year commitment, and it's only a couple times for the week, but we actually haven't chosen, so I can't be like, this is my elaborate title of my research project, but hopefully in a week I can do that. As for practicums, we do have a placement in Toronto for 5 months. For the first bit, they send off 2 PAs and 4 stay here, and we do rotations at Mount Sinai, the forensic center downtown in Toronto, and Sick Kids.
That's awesome. So forensic center, does that mean like you could go do like CSI type stuff afterwards?
I wouldn't say CSI type stuff, but there are definitely some pathologist assistants that are situated in more legal environments, so that they definitely have more experience in those parts, but mostly hospitals, morgues, private labs.
So in the forensic sense, I'm assuming that these aren't the people who are, it's not like CSI, these are the people who like are processing tons and tons of either like DNA gel tests or fingerprints or something.
Oh, that's not us. No.
No?
We let's make a quick little scenario. Someone dies suddenly and we don't know why, and you cut them open, and or even say someone in a hospital setting dies from, I don't know, complications of the heart. What would happen is you'd go in and you'd take out that organ, and say you'd like some prosections or samples of that. We'd take that, we'd gross it, and then it gets sent on down the chain of command.
So it seems like I've been watching a lot of Bones. It seems more along the lines of that than a CSI. Like they do autopsies all the time in that show. That's basically the whole show.
Definitely that is the whole show, and it's not as quick as a turnaround as you think.
Oh, no. Yeah, I understand.
It's not like Joe dies and you know why Joe dies 24 hours from then. But
Hi, Joe.
but yeah, and it also depends on where you're situated again. Some people, or some I should say, some situations you'll be more just grossing tissue samples that come from surgeries. Like some people are actually still on the table, so we need to be very proficient and make sure we let the pathologist know if, you know, the cancer's still in the body and if they need to go back and take out more resections. And definitely other situations you could be strictly in an autopsy setting.
So completely, have you done that yet? Have you done
No.
work yet? No?
I'm still a baby.
Do you dread it?
No, I'm completely excited to delve. I don't want to sound sadistic or creepy, but I'm so pumped to actually just get in there.
No, it's okay. I understand. I also do research, and I'm pumped to learn about 9/11. So, you know, I am in the same boat. I think that happens a lot in this field.
I was just going to ask, when was... So I don't know. I grew up hunting, but I've never really been around dead people. So how was it your first time having to do... You mentioned you had to do it during your master's in fish biology. You had to do some stuff with the human body.
Yeah, assistant. Yeah, and they had cadavers over it.
How did you find that your first time? Just out of curiosity.
To be completely honest, I loved it. To each his own. We definitely had some students that were very apprehensive. They would just, you know, stand back and watch, where we have others that just dug in, and that was me. Like, I wanted to stretch out the intestine. I wanted to see how long it was. Touch the lung and palpate the heart and everything. Like, how often can you say, like, I opened somebody up today and I know the inner workings?
Depends on who you are. If you're, you know, any of us, probably not very frequently. If you're Jack the Ripper, you know, who knows. But
Victor von Frankenstein.
Yeah. Wow, though, that's amazing. So I guess one of the things you've mentioned a couple of times so far has been the word grossing, or writing like a gross protocol. What does it mean to gross?
Okay, very good question, because when I do use that terminology, they think like, ew, gross? No. Grossing is basically macroscopic, the larger picture. So when I say grossing, I mean if we are given a chunk of someone's liver, grossing would be to take that sample and slice it into thinner pieces. That's grossing.
All right, we have another guest coming in. Friend of yours, sorry?
Shelby.
Shelby? All right.
Welcome to GradCast. We now have 2 pathologist assistant trainees in the booth. Shelby is a second-year pathologist assistant. Shelby, I'm Alex. This is Tyson. And welcome to GradCast.
Thank you.
We're getting perspectives right now on the idea of becoming a pathologist assistant. We've talked a little bit about sort of how Steffi got into the program. So how did you find out about it, and kind of what's your background story?
I have a very different background, I think, than most who apply. I actually worked as a pathologist assistant for 2 years at the Ontario Forensic Pathology Service in Toronto, which was fantastic. And that's kind of how, like, my passion, you know, was, I guess, discovered. And so I originally worked there as like a summer student, and then a contract position came on, and they asked if I wanted to take it, and I was like, yeah, why not? And so then I worked there on and off for 2 years on 2 different contracts, working as a pathologist assistant. And so now most of that is autopsy based. So I heard Steffi was talking about grossing, like surgical pathology, which they don't do. So I guess with that, one of the managers there had mentioned this program to me and said that this would be a good opportunity to kind of further my knowledge and also allow me to be more hireable in both like the States and just hospitals in general. So that's kind of how I found out about it, and then I just went through the whole process of applying online, and Bob's your uncle, here I am.
That is a very different story. I guess to go back a little bit further then, how did you get into PAing in Toronto?
In Toronto? Oh boy, okay. That's a longer story. I originally was doing my undergrad in pharmaceutics, and I didn't find that I was quite enjoying it. And so, you know, everybody likes CSI. They always think, oh, you know, CSI, that's awesome. I want to do that kind of stuff. Yeah, there's similarities, but there's a lot of differences. And so, you know, I was going into exams, I think, in my second year. And I was talking to my dad on the phone saying, you know, I was really stressed out and I was really unhappy, and that, you know, I wasn't sure if what I was doing was what I wanted to do. And he had actually just spoken to one of his friends who turned out to be someone he worked with a while back. She had actually taken a position as the manager at the Ontario Forensic Pathology Service. So I guess you could say, in a sense, I had an in. And so she mentioned that they were hiring for a summer student, and I applied there, and I guess I got my foot in the door, and from there it kind of just accelerated to this. So that, I guess that's as far back as it would go.
That's a pretty different story. That's great.
Thank you.
Cool. So I guess getting back to something that we were just talking about again before you got here, we were talking about sort of the first time you have ever either performed an autopsy or dissected kind of a person. And
that moment.
Yeah.
Take
you
you to
know,
that
and
moment.
Steffi was saying, you know, everything was cool. For you, how was it?
It was quite the eye-opener. It was really shocking at first. Like, I had always, you know, I had gone in and I had watched an autopsy. I had seen the embalming process even at funeral homes. And to see that and witness that is completely different from to actually hold that scalpel in your hand and do it. And for me, you know, the entire time I was like holding the person's hand going, please be dead, because God knows I don't want to be cutting into you and you're not dead. And that was my feeling, is my heart was just pounding, and yeah, in my mind I'm just thinking, you know, I am so sorry that this has happened to you, but and I know Steffi will probably relate to this doing anatomy right now. It's almost like you thank that person for giving them this huge learning experience. And that was kind of how I took it, is yes, it's doing a job and it's doing a service to not only that person's family and the community and even the city, you know, potentially, but it's also a learning experience. And for me, at that point, I was being trained on the job. It wasn't going through schooling. So it was like my heart was pounding, you know, you get the sweats, but there's that huge excitement that comes over you. And yeah, it's very, I don't know how to explain it. It's exhilarating, but it's also, you know, I guess gross at some points too. Right?
Well, I've always thought you can't really smell CSI.
No.
So, like, and whenever somebody wants to compare something in either your guys' work or any of the forensic sciences to CSI, I just try to remind them, you can't smell CSI.
No, you cannot. There are many smells out there. Sometimes you just become desensitized to it, which is a good thing on our part, for sure. So.
Wow. It's really nice to hear how kind of seriously and professionally you guys take, I guess, these autopsies as students, because, you know, sometimes I worry a little bit about how people might act, because, you know, it's still school, still trainees, and these are people who have, you know, donated their bodies to science. So it's really nice to hear that, especially in London, where I think we have, on a per capita basis, one of the highest numbers of organ donors
Yes.
per person in the world. Or
Yeah.
something? Like,
Yeah.
aren't we the second highest city or something?
Something like that. Yeah, it's
really
pretty up there. I think that, and I want to say Queens has also a very high level of bodies donated. But London is definitely up there for sure. For
Donate your organs,
donations.
people.
Yeah, it's a
Good
good
thing.
cause.
I'm an organ donor.
I am too.
I
Saves
am
lives.
too.
So yeah, that's amazing. I know that at least for me, I did my undergrad at U of T and I took anatomy, and the only thing that ever kind of fazed me was seeing a person's face.
Yeah.
That really, and it was like a cross section, so you could see, like, you know, half of it was inside and half of it was like
Yeah.
the face, and that a little bit was disturbing for me. But other than that,
See, I'm the guy that's why I had knee surgery 4 years ago, and I asked my surgeon if he would either give me a paralytic so I could watch, or videotape it so I could watch it afterward, because I was genuinely interested
That's really
in what he
awesome.
was doing to me. He gave me one of the most creeped out looks I've ever gotten. When I said, "Can I be awake?" he said, "I'm going to drill holes in your bones. You will not be awake while that's happening." So I kind of get the draw to the unknown. Like,
It is.
I you know, I'd love to know how more of me works, but they don't really teach us that in math.
No.
And it's not as exhilarating either, I have to be honest here. It's
So, like, what are some of the things that working in that environment? That's my euphemistic language. What are some of the things that you learn that someone on the outside might not know?
That's a good question, actually. Yeah.
Can you say that in a different way? No.
Is there something that goes on?
Quality traits,
Is
or-
there something that goes on inside when, you know, you're digging through there that we don't know? That, like, you know, most people would have their assumptions as to what that experience would be like, but they wouldn't know. Like,
so I think I know one thing about so kind of what you're asking, and it might be kind of something that you guys can either tell me I'm dead wrong about. Oh, I used the word dead. I probably shouldn't have. Either I'm
Funny.
wrong about, but it's, or I'm right about. I was told, and I thought this was true, that when a person dies, they immediately vacate both their bladder.
Not true.
Okay.
There you go. Not true.
So I learned
Not
something
always.
new.
It can happen, and you know, it definitely sucks for us when it does happen, but it doesn't always happen. No. I think I don't know how vulgar I want to be here, but I think when you are closer to, say, having to go to the bathroom and then perhaps you die,
It's more likely.
it's more likely, you know, because you're kind of further down the pipeline. We'll say.
That's a great analogy. No, I love it.
But otherwise, no. And even, you know, urine, again, can be same or different. It depends. Like, yeah, the sphincters and everything relax, but that doesn't necessarily mean you, we'll say, defecate yourself. So, not always true.
That was very insightful. I was just
I'm trying to keep it as clean as possible.
I was just gonna pop in and say, I guess you learned that CSI smells, but Tyson's got a lot up on that. So yeah, anything else that you guys learned, or?
It's as wet as it looks.
Mm.
Like cutting into like the pleural cavity, like around the lung, or the pericardium around the heart. Things do ooze, and you only do have like eye protectors. So I've had some cheek accidents, and some chin accidents.
Yeah.
So you need tough skin, literally.
Oh God.
And so you just grab a little paper towel and but be aware, like when you do cut into sections.
Oh, so things can,
No.
Not spurt, but
I was going to say spray, but yeah.
but depending on the angle with which you cut it, like the pericardium's very adhere tightly to the heart. So when you peeling away that, you get a little splash.
Wow.
Yeah.
So Tyson, for your illustrious career as a pathologist assistant in the future, bring a wetsuit.
And some paper towel.
And some paper towel.
I'll be hazmat
Maybe
the
some
whole
windshield
time.
wipers.
I do have to ask, like you said, you were so excited about the process. Like, how do you get used to this? Like, how did you not just the first time?
I think a big part of it is understanding that it's a whole part of the process. Like, death is natural, it happens, and picking this career path, you know that this is something that needs to be done in the healthcare. And so having that mentality, you go in there and you're like, I'm excited. What I do is, bettering the efficiency of the pathology lab, and I'm helping somebody else, as Shelby said, like families and loved ones who want to know what happened. And so I'm learning, and yet I'm helping others. So it's amazing.
I think another, just to add to that too, is especially in hospital cases, it's also a way of, for doctors to learn and see what went wrong, what they could have done better to even treat a patient. So there's this whole other aspect that a lot of people just, when they hear autopsy especially, they think CSI, and they think forensic, but they don't realize that there's this whole other surgical aspect to it, and how, doing an autopsy on what we like to call a hospital case, so say someone who had just died of some sort of terminal cancer, that can really help the outlook of or treatment for patients to come.
Okay.
And I don't think people actually realize that. And then on top of that, with forensics too, kind of going back to your question, would be something that I find that I don't get used to. So you've got your guts and your gore and all that fun stuff, which is fine, but I think something that I have the hardest time getting used to is trying to detach yourself from that person. And so, you have this body come in and you read, their history of what happened to them, and you really have to learn not to personalize things. And that can be the hardest thing, especially working forensically and dealing with very sensitive and high-profile cases.
So in the day-to-day, what would be the difference between what you guys do and, say, in forensics anyway, and what a coroner does?
Well, okay. So forensically, what a PA would do, and as opposed to a coroner. So the coroner is the person that kind of goes to the scene of, say, like a crime, or again, God forbid, a suicide or something, where the decedent is. And they would investigate and work with the police to find out, okay, what happened to this person, why, or they have to answer, I think it was 5 questions. I gotta go back to my forensics here.
Who, when, where, why, and how. I think that's it.
Yeah.
It's very standard.
So that's their job, is to answer those questions. And if they can't, they order an autopsy. And then that's when the pathologist comes in, and they are obviously the one to kind of figure out, well, for the majority, the disease process, or just why or how they died, kind of thing. The PA comes in as, in a forensic stand, kind of the grunt worker in a sense, but I also like to say that we get to do all the fun stuff, because we get to deal with more of the body and taking trace samples, taking fingerprints, toxicology, doing all the organ dissections, that sort of thing. So we get to do the messy work in a sense, but it's also a lot more fun, I find. And the coroner just does a lot of paperwork.
All right. If I could be permitted one more question. So
Yeah.
can I have you guys both say so far what your favorite moment in this field has been?
Oh, gosh. Evil question.
That's tough.
Can I say everything? Is that
cheating.
It's not cheating, because like being a fish biologist and dissecting fish and then moving on to like the grand scale of a human body, I've never seen the inner workings of the neck and the vasculature of the body and how it connects, and looking at my own body and being like, so that's what that was, you know? So if I had to pick.
When I was a kid, I did some fish dissections, but it was mostly because we wanted to eat it.
Exactly. Maybe do you have one pinpointed already, Shelby?
And I think it's similar to what you're probably trying to say, and I think the biggest thing is not necessarily the job. Like, I love the job, and having worked it, yeah, I can say that. But I think the best thing so far along this journey has actually been my anatomy classes. And I think it's because it's this huge learning experience, and it's like your basics, and then where your passion is kind of founded is within that class, and where all your knowledge comes from. Like, yeah, you can sit and open up a pathology textbook, but you can't sit and just dissect a person in any other class. And I think for me, anatomy has been the most precious course that I have taken in my entire life. Well, in my entire career, I guess.
Okay, I feel like cheating. I'm not cheating anymore. I think my most favoriteest, amazing, was we got to go into the pathology suite, or where the morgue was, and I think
In the
so I
hospital?
think two of the upper PAs were grossing this huge thing. It looked like a lung, but it was actually a kidney, a polycystic kidney.
Yeah.
So usually your kidneys are like the size of your, I would say a little bit larger than the size of your fist. This one was like 4 or 5, and it was just covered in like boil-like structures, which are cysts, so hence the name polycystic. But that's the favorite thing. Like everything, you never know what you're gonna get.
Yeah,
When
every
you're-
day's a different day. That's what I like the most, is every day's a different day. Sure, you're doing the same job, but every case, every specimen, everything is different, and you may come across so many things that, like, oh, it's another lung, but hey, I found this, and that's different, sort of thing. Like, it's always different, so it's always changing, and I like that, and it's not just your normal desk job, too.
So I guess moving forward with the program and with your careers, what do you guys see in your future, I guess, as pathologist assistants? I guess that would probably be the last question for each of you guys, because we've got to wrap up after this, but what do you think?
You're further along, Shelby. What do you got?
I don't know. It's funny, because this is similar to what they asked me in my interview, and I was like, I don't know. 5 years, I don't know. What do I see? Well, I would love to stay in Toronto and work. I mean, my ideal job would be to work both an autopsy and grossing position, but also have a teaching position. Because I love teaching. I would actually love to continue teaching PAs, to be honest. Because it is such a fantastic field that a lot of people probably didn't even know about until recently, really. But yeah, my future, I look at staying in Toronto, but I am totally not opposed to going to the States as well as an opportunity. So that's pretty much it.
Snowballing off of Shelby's response, definitely teaching. Definitely have a passion to disseminate knowledge, and I'd also love to even stay on with research. I do love research. It's one of the biggest reasons why I'm in graduate school. So I don't know, there might be a PhD in my future. I don't know. We'll see, but I really do love seeing it and then actually getting down to the molecular and how it all comes together.
Yeah.
That's awesome. And if I could actually ask one last question. I know we have an extra couple of
we have an
minutes.
extra few minutes.
So, both of you guys bring up teaching, and I wanted to ask earlier, actually, so you were talking about, as a PA, you get the opportunity a lot of the time to find new things which actually can be beneficial to clinicians, doctors, and patient care. Do you get a lot of opportunities to go back and either give the rundown to the physicians and teach them, or other people as well, what your ideas might be for what could be done in the future as a PA?
That's a good question. I personally don't know. I haven't seen it done, but you know what? I have to say I don't doubt that it's totally possible. I'm sure, and especially at the university hospital, like they're really open and happy to have PAs partake more in research and more in improving healthcare and everything that way. And a lot of the pathologists there, like they work with the PAs and even the PA students on a lot of our research projects. So they're all very open to having extra and more input. I just don't know if it's ever been done, per se, in the time I've been there.
But on a cool aspect, some PAs actually do go on to teach pathology residents on grossing and stuff like that. So might not be the doctor itself, but they're up and coming. So we do have an opportunity to work with them. We teach exactly. Are you hearing that? The future is in our hands.
That's awesome. All right, thank you guys very much for coming on to the show. It's been a very different episode, and I'm glad that you guys came.
Can we do a shout out?
Sure. Yeah.
I'd like to shout out my first year fellow PAs. I love y'all. Chelsea, Emily, Derek, Shushay. I love you all.
Any other shout-outs?
And Kyle. I'm sorry, Kyle.
I was going to say, you forgot
Oh my gosh, Kyle, don't hate me.
I don't know. All my second-year PAs are off in Toronto right now, so I guess just shout out to them.
Yeah.
All right, thanks a lot, guys. Tristan, take it away.
All right, guys. Well, tune in next week when Future Talk comes back, and we will be back in 2 weeks. And we'll talk a little bit about our upcoming podcast then. Until then, this has been Gradcast on CHW 94.9. Stay classy, London. That's all for this week. Gradcast is created and funded by the Society of Graduate Students at the University of Western Ontario and goes live once every other week on CHRW 94.9 to the London, Ontario area. We are reachable on Twitter at GradcastRadio and email at gradcastradio@gmail.com. See y'all next week.